Florida Medical Association, helping physicians practice medicine.
Hi, I'm Jeff Scott, General Counsel of the Florida Medical Association, and today I've got some good news. As most of you know, the Florida legislature last year passed a bill that requires physicians and other healthcare providers to obtain a patient's written consent prior to conducting a pelvic examination. The confusion over this bill was profound. The questions were many, and we were simply not able to obtain any official, definitive guidance to any of the questions that we had. The Department of Health refused to provide answers, and the Board of Medicine provided some guidance, but only through a declaratory statement that has limited applicability. Given the uncertainty provided by this bill, the FMA worked with other interested groups over the summer to craft a glitch bill to fix the many problems of the 2020 legislation. After a tremendous amount of effort, rewrites, and meetings with legislators and legislative staff, this week, the legislature passed Senate Bill 716, which provides answers and certainty to many of the problems posed by last year's pelvic exam legislation. Senate Bill 716, if signed by the governor, will redefine the term pelvic examination to make it clear that the term only applies to a manual examination of the organs of the female reproductive system. The term will not apply to an examination of a male patient, nor will it apply to a visual assessment, diagnostic imaging, or a non-diagnostic medical or surgical procedure. Written consent will only be required when a pelvic examination is conducted on an anesthetized or unconscious patient. If the patient is conscious, only a verbal consent is required. However, the House did insist that this verbal consent be obtained even if written consent is also obtained. We were also able to clarify the exemptions to the consent requirement. Consent is not required if for a pelvic exam when emergency care and services are being provided, nor is consent required if the patient has an emergency medical condition. These were two provisions that were inserted to clarify last year's confusing and unnecessarily restrictive emergency services language. New provisions were also added, exempting consent for child protective investigations and when an exam is administered pursuant to certain criminal investigations. While we attempted to include provisions that fully clarify the when, how, and how often consent has to be obtained and by whom, unfortunately, we were only able to obtain language that makes it clear that for pregnant patients in labor in a hospital, written consent is only requested one time and not every time a pelvic exam is performed. We're hopeful that the governor will sign this legislation, and if he does, the provisions of Senate Bill 716 will become effective July 1st, 2021. If you have any questions concerning the effect of this legislation and how it interplays with last year's requirements, FMA members can always contact me anytime at legal@flmedical.org. Thank you for being an FMA member.
Florida Medical Association, helping physicians practice medicine.